Over the next few minutes, I'm going to talk about a very specific condition that some men with pelvic pain suffer from. That condition is called hard flaccid. Now, hard flaccid is not a recognized medical diagnosis. This is just the name that it is taken on by the community of men who suffer with these symptoms. Because it's not recognized, it's not well researched, so it's not really well understood. So over the next few minutes, I will talk about the little bit of research that has been done and try to explain what this is, why it happens, and what you can do about it. So first, the most common symptoms of hard flaccid is when the penis is semi-rigid in the flaccid state. Some men will report differences in sensation in the penis, such as a feeling of coldness or maybe numbness or just decreased sensitivity. Often men will report a decreased rigidity of their erections. Some will say that they have pain when they urinate or when they ejaculate, and that pain can be in the penis or in the perineum. Often men will report a feeling of pelvic floor muscle contractions or tension, and most men will report a significant amount of emotional or psychological distress, and that may be things like anxiety, depression, loss of libido, or insomnia. So how does this happen? Well, the leading hypothesis is that they think it results from a traumatic event, and that traumatic event may be due to the use of a penile pump or vacuum, rough masturbation or sex, or some sort of injury to the base of the penis. So this injury to the base of the penis could impact the nerves and the vessels that supply the penis and the pelvic floor muscles, resulting in these symptoms. So specifically, how do these symptoms happen? Well, when the injury happens, it can cause a severe emotional distress, and that can stimulate a specific part of our nervous system, which is called the sympathetic nervous system. And that overstimulation of the nervous system can cause our pelvic floor muscles to contract. And then with sustained contraction of these pelvic floor muscles, they can compress nerves and vessels that supply the penis and can limit some of its normal function. Additionally, the specific muscles that are involved in sexual functioning, these are the superficial pelvic floor muscles, if they are in a sustained contraction, they can impact the venous structures, resulting in this semi-rigid state. So how does one diagnose themselves or get diagnosed with this? So first is just looking at your history. If your history is consistent with what I described, then this indeed might be what you are suffering from. Next is just observing the penis. If the penis looks engorged in a flaccid state, then it may be hard flaccid. Additionally, if the glands of the penis remains flaccid in an erect state, that's another clue. The base of the penis may also feel hard to touch. And lastly, when consulting with a urologist, you may have some tests done. And those tests could be imaging, a Doppler, blood, and hormone tests. And all those tests will come back negative. So when consulting with a urologist, there are a couple other diagnoses that you would make sure you would rule out. One is high flow priapism, and the other is non-erecting erections. So how do you treat hard flaccid? Well, remember that a multimodal treatment approach is always best. So to make sure you have a good pelvic floor physical therapist that can help you treat the pelvic floor dysfunction. A mental health specialist can help with any emotional or psychological distress, and that may include things like cognitive behavioral therapy or a mindfulness practice. You may need to incorporate some behavior modification. You may need to temporarily discontinue exercises that could be contributing to this, such as cycling or squatting, and make sure you're getting enough sleep and eating well. In some cases, certain medications have helped to either decrease pain or decrease erectile dysfunction. And in other cases, low-intensity shockwave therapy has been helpful for some folks. If you found that video helpful and want to learn more, please click on the links in the description of the video that can help you find the right person to diagnose and treat you.